People may not know that better options exist. Communities may still associate TB treatment with long, difficult journeys. There's still stigma, hesitation, sometimes even fear. And even when systems are ready on paper, they're not always fully responsive at the last mile. So that last mile is where things often slow down. And that is exactly where communities come in. Communities are not just beneficiaries of care, they're not just passive, they are one of the strongest drivers of whether an innovation succeeds or not. And I think with newer diagnostics and near point of care coming into play, this conversation is even more opportune and important. If I had to break it down, based on our learnings from our experience with Fast Track the Cure and working with communities and partners like the Dopasi Foundation, I would say communities influence three key things. First is awareness and understanding. Second is demand. And third is accountability. Now, drawing briefly again from the Fast Track the Cure experience, one of the biggest learning has been this. Awareness alone does not drive access. You can inform people, but they're unless an actual part of that conversation and trust it, they won't use it. So innovation does not fail in labs. It fails when it doesn't reach people. For example, when new DRTB regimens like BPALM were introduced, or even the new point of cares get introduced. These are breakthroughs, but on the ground, there will always be questions, hesitations, uncertainty. And only when communities are actively engaged, things can change. So with BPALM, when TB survivors spoke, when communities were explained in simpler terms, when people asked questions, trust increased, uptake improved, and adherence strengthened. And much of this is what I believe all of you must also be seeing on ground. So people don't just adopt innovations, they adopt it when they understand and trust it. Another important learning, communities don't just receive information, they also provide it, right? They tell us what's not working, where access is delayed, where systems need to improve. And that feedback helps programs move faster. So community engagement is not just support to the system, it is also how systems become responsive. So strong community mobilization does not just support implementation, it accelerates it. If we are serious about scaling TB innovations, be that in treatment or in diagnostics, community engagement cannot come later. It has to be built in from the very beginning. So you cannot scale access without scaling trust. So because scaling is not just technical, it is human. It depends on understanding, on confidence building, on trust, and that is something only communities can enable at scale. So just to close, I said I'm going to keep my thoughts very brief on this, and this is something that I would really expect and appreciate if all the technical experts on the world take this into cognizance as they continue to work towards bridging the gap between availability and access to these innovations, be that across the DRTB care spectrum. We need to understand that moving from awareness to access is not automatic. It requires intention, it requires partnership, and it requires investing in communities as equal stakeholders. So I'll just close by saying, if we really want to move from awareness to access, we need to move from only informing communities to actually partnering with them. Because when communities are empowered, innovations does not just stay in guidelines or pilot projects, it actually reaches people, improves lives, and strengthens the system as whole. Thank you once again to the Dopasi Foundation and the organizers for the opportunity to share my thoughts briefly and for the important work each one of you is doing to strengthen the TB and DRTB response. That's all from my end. Thank you so much, everyone.